So welcome to another edition of our Global Mass Vaccination Site Collaborative Learnings. We're really excited with our presenter today from CORE, Matt McCoy, to learn about his wonderful work. Next slide, we'll talk about some ground rules. So if you can mute yourself when you're not speaking and use the reaction buttons that are located at the bottom panel. When we do have a question and answer period, this is really all about you and helping us as a community empower each other. So that's the most important part of this. So please raise your hand with your icon, or if we can see you, you can physically raise your hand. If you do raise your hand with the little icon, you will come up to our upper left so we can call you out, which is really helpful. And you can also ask questions and engage during the chat throughout if you're more comfortable using that method. Next slide. So our global mass vaccination site community practice is a joint venture between Boost, which you'll hear about more in a moment. They are a wonderful organization with longstanding efforts on vaccinations under the umbrella of the Sabin Foundation. And Boost is teamed with Ariadne Labs to form the Global Mass Vaccination Site Collaborative, and we have been funded and supported by the Bill and Melinda Gates Foundation. Our objective has been to establish an open access community where we can learn from each other, from the front lines to the C-suite and leadership at a national or a regional level. So we can understand and collaborate by building a website with a variety of different resources, which we'll put that link in the chat. That includes playbooks and tools and checklists and articles to help us think about deployment of vaccines on a large scale. Two is these webinars that we're doing on a weekly basis that include a larger group and then smaller targeted sessions for more of a smaller conversation to really help troubleshoot local issues and help each other build on each other's strengths and identify the barriers that we all have faced. And finally, a broader link to the Boost community, which has an amazing platform. And I'm going to hand it over to Jenna, who's going to speak a little bit about Boost. Next slide.
Thank you, Eric. Hello, everyone. I'm Jenna Groman, the Director of Global Communities of Practice at Sabin. And I'm thrilled to introduce you to the Boost community. Boost is a global community of more than 2,000 immunization professionals from, I believe, over 135 countries now. And we're designed to help immunization professionals connect with peers, learn from each other, as well as build capacity through other courses and events and activities, so that these immunization professionals are really enabled to lead their immunization programs through complex and challenging circumstances. So really excited to join this event today and welcome you to this event. And we hope that everyone joins the Boost community and also joins the learning group that we have set up for the Global Mass Vaccination Site Collaborative to learn much more about specifically mass vaccination sites and campaigns. Over to you, Eric.
Thanks, Jenna. Next slide. And Ariadne Labs is a lab that's a joint venture between the Harvard T.H. Chan School of Public Health and Brigham Women's Hospital, which is a academic teaching hospital that's part of the Harvard Medical School system. And our focus is implementation science, and have been engaged globally for over roughly the past decade, and engaged with over 165 countries on key initiatives, this being one of them, vaccine delivery, along with the others that we've outlined below. So really excited to partner with Boost and Gates and you to work on this effort. Next slide. So now I want to introduce Matt McCoy. Matt is really awesome. He's the Brazil Program Area Manager for Core Response. Matt's going to speak to us about the experiences domestically in the United States and his experiences and their experiences Core has in Brazil and Haiti, to share lessons learned from each of those sites, what's working, where the challenges are, And I'm really excited for really a robust conversation after his presentation, and would encourage you to ask questions and ask the hard questions so we can all learn from each other. So without further ado, take it away, Matt. Thanks so much.
Thank you, Eric, for the introduction. Good morning, everyone. My name is Matt McCoy. I'm with Core Response in Brazil as the area manager for our programs here in the country. We can go ahead and get started with the presentation. All right. So this will be our global case studies, our lessons learned from everywhere we've been, and recommendations we make for future global VACCS work and such. Next slide, please. So a little bit about CORE. CORE is an NGO that was founded in 2010 in Haiti after the devastating earthquake that happened. And for about 10 years, CORE maintained programs in Haiti as well as other Caribbean countries such as the Bahamas. And then in 2020, right in the beginning of the pandemic, CORE stepped in to start a COVID-19 response in the form of testing. And across the US, from Los Angeles to Georgia, Chicago, New York, New Orleans, CORE started robust testing programs through mass testing sites, mobile testing sites, et cetera, as well as helping with resource coordination, helping folks get the supplies they need in the tough time that was and is the pandemic currently, helping with community outreach and contact tracing and such. And then once the vaccines were available toward the end of 2020 and beginning of 2021, we quickly shifted operations from testing to vaccinations, where we were able to apply a lot of our learnings from testing into vaccinations and learn with what we were doing. Next slide, please. So after we mounted our US vaccine response, we took our lessons learned to 3 countries, Brazil, India, and Haiti. And we started there in those countries around the same time, like May, June of 2021. And we really expanded into those areas to help provide input and technical expertise for vaccine operations, helping these countries mount their vaccine responses if they didn't have the resources necessary to mount such a massive campaign. We're strengthening the existing systems, local health departments, and helping really bring the vaccines to as much people as possible, as quickly as possible. Next slide, please. So our main strategy that we brought to these countries is partnering with local governments and community organizations. This is what we did in the US from the beginning. When we started in Los Angeles, we were partnering with local governments, fire departments, trusted community spaces. So that way people feel comfortable and they know that it is a secure place to get a vaccine. It's a good place to get a test. And we're really expanding the capacity and to deliver these services while also relieving a burden that would have been left on a singular health system or health clinics and healthcare workers. Next slide, please. So in the development of these local approaches, there is a couple processes that CORE underwent and what we learned from. So CORE explores the gaps with government and community partners. When we show up to a space, CORE really wants to learn where are the gaps in the communities and how we can best serve those gaps. And a great way to serve those gaps is to actually higher up in the communities, making sure your employees, your people that you're working with closely are actually from the communities, people that understand, and people can create a tailored approach to their community. And by doing this, you build a trust within that community right off the bat. As for the challenges, when you're mounting a big vaccine response and your goal is to vaccinate thousands of people per day, it's really important to have a strong sense of operational flow and efficiencies, responsibilities for task shifting or for tasks, and shifting those tasks to other people. For example, when a nurse is pulling a vaccine, do they have to do everything? Do they have to register the patient? Do they have to go through the whole process? Core, we really relied on some administrative support, pairing nurses with administrative scribes to help them register patients. And that would really allow the nurse to focus on making sure that the medical aspect of everything was correct. And everything was closely coordinated between the communities and Core. Next slide, please. So like I said, we really like to maintain a community focus with our trusted local partners. For example, in Los Angeles, we work very closely with the fire department. In Georgia, they work very closely with the Georgia Department of Public Health. And again, hiring from the community builds that trust. Making sure that we are being as efficient as possible, shifting non-clinical duties to other staff to enable focus on injections and medical oversight, as well as being flexible, because right in the beginning of the vaccine campaigns in the US, things were changing every day. There was tiers that were opening up every day. One day would be very slow. Next day you have thousands of cars lining up out the door, and you just got to be flexible and know how to position yourself to help improve the efficiency of the process as well as the patient experience, because the better the experience is, makes it easier to go forward and do other similar vaccine campaigns in case of any other future pandemic or booster shots. Next slide, please. In the US, we also helped with technology integration. We used iPads and tablets and electronic data, really utilized Excel sheets and inputting different surveys and forms to make sure that everything was being as efficient and accurate as possible. Also, we were there holding our partners accountable for quality control, making sure that the whole process was correct, making sure we were doing the community right, and that the operation of it all was sound. Next slide, please. So this is more my wheelhouse. I was a part of the US response for vaccines in the beginning, but in the third month, I moved on to go to Brazil to bring our learnings there. So Core arrived in Rio in April 2021, and the initial federal government response did not allow for a quick way to mount a vaccine campaign, because government didn't order enough vaccines, causing a low vaccine supply. It was difficult to procure consumables, syringes, other needed equipment. And we started in vaccinating in Rio in May 2021. And we started with 4 mass vac sites using those applied learnings that I've already talked about from the US. Next slide, please. So mass vax in Rio ended up being very, very important. Like I had mentioned before, in our US response, we did a mixture of mass vax as well as mobile vax, where mobile being smaller teams going into the communities, going door to door, going to just maintaining a small team and able to move quickly through the community. But that didn't actually work well in Rio. Mass vax was really important because Brazil has a history of big vaccine campaigns. People are generally not that hesitant to receive a vaccine. So when people were able to get vaccinated according to their tier, it put a lot of strain and pressure on local health clinics. So by building big mass vax sites, it allowed the clinics to maintain normal operations. I remember this one clinic that we went to is very tiny, and it was filled with hundreds and hundreds of people all there for the vaccine. And I just couldn't imagine how other essential services were being delivered amidst all that chaos. So we built a big mass vax site right next to that clinic that really relieved the pressure off of them. Another reason why mass vax works in Rio instead of the mobile approach in the communities is that Brazil has a very transitory low-income population, meaning that where low-income folks live is not necessarily where they are during the day. There are a lot of jobs in Brazil, such as cleaning people, doormen for buildings, etc., that they tend to gravitate more toward the higher income areas during the day. So by building several mass vax sites across the city, you're able to capture a lot more people versus going into the communities with mobile teams. Next slide. So in Brazil, our biggest successes were being very collaborative and with our local partner, the health department. We were able to examine numbers, looking at how many people were getting vaccinated at this site, where some sites were still in high demand with some strain. So we were able to act quickly, be flexible, open new sites, diminish some operations in some areas and move resources to other areas. And using community spaces, we used Samba schools, we used sports centers, we used theaters, etc. And these are spaces that people are accustomed to going to. So when the time for their vaccine came, it made them excited to go into a Samba school and get vaccinated at a place that they've been going to for years already. Our biggest limitations in Brazil was always the vax supply, especially in the very beginning in May, June, July 2021. Created some days where it's very slow and not much people getting vaccinated, just simply because there was not enough vaccines to give. Another limitation was data management. Because Brazil has a universal healthcare system, all the vaccines had to be input, registered into their universal system, which was very buggy, always crashing, very hard to connect to. So we helped the health department in several mass vax sites utilize spreadsheets they were able to use to quickly input and register everything at a time when the system was correctly working. And so we did vaccines in Rio from May to November 2021, and we were able to deliver 417,883 vaccines in that time. Next slide. CORE started in India in June 2021 in the Pune and Mumbai region. The CORE received a generous donation from the Serum Institute in India of 100,000 vaccines of Covishield, I believe. And it's a totally different context than Brazil and totally different context from the US, but we're still able to apply some of our learnings to India. So India was highly regulated. it was hard to give strong input and recommendation as to where people can get vaccinated, because the local regulations determined where those points would be. Initially, people could only get vaccinated in hospitals, and that created a hard barrier for people living in slums in Pune and Mumbai to access vaccines, because they all had to go into hospitals to get vaccinated. But over time, the regulations were modified to allow for vaccine sites to be opened outside of clinical settings, which really allowed CORE to shine and use mobile units in communities. So whereas Brazil had a transitory low-income population, which allowed for the mass vac site to thrive, in India, the mobile units really were essential for those vaccines. Having small teams go into the communities, into the slums, to vaccinate the population there and actually bring the vaccine to the people. Because this was more convenient for the people to get vaccinated, and decreased the hesitancy, because when you're able to go into the community, you're able to talk about it. It's less of a show. It makes people more comfortable and willing to get the vaccine in those vulnerable neighborhoods. Next slide. So we're almost up with our 100,000 dose donation from the Serum Institute. So as of today, CORE has helped deliver 96,697 doses of the Pune and Mumbai region of India. Next slide, please. So CORE also started in Haiti in June 2021. And one of the biggest problems with Haiti has been the infrastructure and the information system. The context of this is, this devastating earthquake that happened in 2010 and still recovering from that, as well as the other earthquake that happened in August 2021, the assassination of the president that happened last year. Haiti has a very poor infrastructure for roads and power. So it made it hard to deliver vaccines to areas around Haiti, especially in the rural areas. And they were doing everything with paper-based data collection. So it was hard to tell on the digital systems. If you just gave it a Google, if you looked at the National Health Department, it was hard for them to be able to tell how many vaccines had been delivered, what the vaccine demand was. And it was extremely inefficient to have to transfer everything onto the online database. And there was a lot of vaccine hesitancy in Haiti, and people were not so comfortable getting vaccines in public. Mass vac sites in the US and Brazil, you're in your car, you're standing in a line, you're watching everyone else get vaccinated. But in Haiti, it was really important to have privacy screens and privacy curtains to make the processes a little bit more intimate with the clinician and the patient receiving the vaccine. And since June 2021, CORE has helped administer 128,467 doses in Haiti. Next slide, please. So the big key recommendations for global vaccination is building trust, using those community spaces, using those local partners to build as much trust as possible in the community that you're trying to reach. It's really important to build and maintain that trust. Bringing the vaccine as close as possible to those vulnerable communities, making it as easy and taking down as many barriers as possible to allow the people to get vaccinated. Being very flexible is important. Things change, supplies fluctuate, vaccines will come and go. Tiers will determine how many people get vaccinated in a day. So it's really important to be flexible and change your operations and be able to move things around on a day-to-day basis to be responsive to the current demand. And it's really important to understand the local culture and how it influences how people feel about the vaccine, why they're hesitant, why they're not hesitant, why they're more willing to get vaccinated with a mobile team versus the mass vac site team, whether they're able to get vaccinated in a public area versus a private area, etc. So it's important to know the culture where you're getting, where you want to deliver those vaccines. And currently CORE is bringing these lessons learned from not only the US now, but now Brazil, India, and Haiti to Uganda. We have a team there right now setting up vaccinations in rural areas. Because as of now, Uganda has had higher vaccine rates in the urban areas, but the rural villages outside of those urban areas still have low vaccine rates. So CORE is there currently making these recommendations right here, making sure that these vaccines are closer and taking down as many barriers as possible to allow people to get the vaccine if they want it. And that's it from me. Thank you guys for listening. Thank you.
Awesome. That was awesome. An awesome overview. And CORE is rapidly expanding across the globe. So really, really impressive work, Matt. So now we want to open it up to some questions. If you'd like to ask a question, you can put it in the chat, or you can raise your hand using, again, the reactions at the bottom and raising your hand so we can get you prioritized. I'm going to shift to questions. So Jenna, thanks for starting us off with a couple questions. One is, do you want to just go ahead and ask those, Jenna? Maybe that's easier.
Sure, I'm happy to. Matt, thanks for a great presentation. It was really interesting to learn everything CORE has done across the world and all of the lessons you've learned. I had a couple of questions for you. First, you mentioned Brazil's history of mass vaccination campaigns leading to less vaccine hesitancy and higher demand. And, you know, as we all know, vaccine hesitancy has been a challenge across many, many contexts. And I'm just curious if there's any lessons we can learn from Brazil's history that can be applied to some of those challenges we're experiencing with vaccine hesitancy elsewhere to help drive demand and help, you know, not only with COVID-19 vaccines, but, you know, looking toward the future as well.
Right. That's a really good question. Thank you. It's not to say that Brazil doesn't have hesitancy with vaccines. I think you're going to encounter that everywhere, especially with the current political climate in Brazil, with a government that's a little bit more conservative leaning, a little bit more polarizing when it comes to new vaccines, as evidenced by, you know, the initial response from the government to the vaccine campaign, not ordering enough, not being prepared to mount a mass vaccine campaign. But Brazil does have a universal healthcare system that was developed, I believe it was in the 80s, where it's called the SUS, the unique health system of Brazil. And this allowed for a lot of essential vaccines to be provided free to anyone, Brazilian or not. Anyone who wants a vaccine can get a vaccine for a lot of the most common vaccines. So I think there's about 12 vaccines that you can get absolutely for free. And everyone just does it from when they're born to adults. You just get all the vaccines And I personally believe that this has probably created a culture where, you just get your shot and that's it. And you don't really think about it you don't think that intensely about it. So when the time came to take the COVID vaccine, a lot of people didn't question it as much. They just accepted that they needed to get a vaccine and they took the vaccine. So I think the more people get vaccinated, the less hesitancy you'll see in the future. So it would be interesting to think about how the need for future mass vax would play out. I believe that people would be a little bit more accustomed to the process of needing a first dose, a second dose, a third dose, whatever to get this, to get whatever vaccine they need.
Great. And I think Jenna also had another, I think you had another question about Uganda, which we're excited to hear about. Tell us a little bit about your plans there.
Yes. I'm not too familiar with the Uganda at the moment. The team just got there 2 weeks ago. And I was able to have a phone call with the CORS project manager there. So it's looking like they're going to do mobile teams in villages and go from village to village with a local health partner.
That's great.
Yeah, so I'm excited to see how it develops in some time.
Yeah, looking forward to hearing about your progress. And just curious, another question, CORE is involved in so many different activities. I know you're involved in the crisis in Ukraine right now. It's sort of related, unrelated, but, is there anything related to vaccines that you're doing in Eastern Europe at this point, or is it a different response? Is it really focused on other refugee care issues?
I think we have our team over there looking into different health partners. I think right now, especially with the recent Omicron surge, testing is very important, especially when you have hundreds of thousands of people fleeing into neighboring countries. Testing would be really important. I'm not so sure they're looking into vaccines just yet, but I know it's on the table to provide some COVID-19 response to the neighboring countries of Ukraine for the refugees.
Great. Thanks, Matt. Other questions for Matt? You can raise your hand, chat.
I'd also be curious from everyone else on the line, and I see another question popped up, so I'll just open this up and then we can go to the next question. But I'd be curious from everyone else who's on the call today, who has set up similar mass vax sites, perhaps in their countries, what, any reflections on what Matt shared? Are you seeing some of the same challenges? Have you, had any specific successes or solutions to some of those challenges? Just for a little bit of sharing, but we can move on to some of the questions and then maybe come back to that.
Yeah, that's great. It's a great call out, Jenna. So Jean-Pierre asked, are you present in DRC?
Not at the moment, but who knows? I think we're starting with Uganda in the African continent, and we might look toward expansion in the future.
And Say or Sai, I apologize if I'm mispronouncing. I said, from your experience, are there any specific strategies that you would recommend for a country with high hesitancy? I think you touched on some of this, but maybe you can expound a little bit, Matt.
Yeah, high hesitancy means you really need to understand where this hesitancy is coming from. And usually it's a matter of education. So while CORE does help mount the operational aspect of vaccine sites and mobile teams, we also do invest a lot in community education and having community outreach, community mobilization. You know, some of these mobile teams will go out, not even with a vaccine, but just with educational materials, helping people understand what the vaccine is, why it's important for someone to get vaccinated, and really try to teach and educate people the importance of the vaccine. And this is how CORE has treated areas with high hesitancy. We see this a lot in Haiti, and as well as New Orleans, Georgia, and Los Angeles. And this is where we put a lot of our energy into community mobilization and community outreach.
Great, thanks, Matt. I think it's something we're all struggling with, and appreciate, you know, the sharing that's happening right now. Steph asked, how do you determine local culture? Is there some trial or error which could be problematic?
Yes, definitely trial or error. Unfortunately, not everyone in CORE comes from these areas that we're going into, but we're very lucky to have a very diverse group. I'm Brazilian, so this is why I was asked to take my US experience to Brazil and help build our programs here, and working with local partners and the local health department. They are very informative. These are the people who know their communities the best. You know, in India, we had our program manager who was from India. We hired up within the communities. So it's really important to build a team and to have the people around you from that area to determine the local culture, because they will give the best insight as to how to proceed and build your operations. But definitely there's some trial and error in there. And that's just part of being flexible. You know, if one thing doesn't work, try something else, move your resources around, you know, yeah.
Yeah, that's great, Matt. I mean, there's the old adage that every disaster is local, and the idea of identifying trust brokers in the community, whether it's public health, grassroots organizations, priests, chaplains, rabbis, clergy, whatever it may be, who they are, getting to them and understanding their perspectives. As certainly we've seen that in a variety of different domains. Curious, you know, we'll go through the other questions, but curious about you know, people, you know, if you could share if there's different groups or individuals that have been real trust brokers in your community, how you've identified them and how you've learned from them. So look forward if others want to share their experience. Tanya asked, how do you promote vaccinations to youth?
I'm not too familiar with the CORE's process of the community outreach. I'm more on the operational side, but I believe it's still more of the community outreach, talking to the parents, making sure that the parents understand the importance of everything, and really taking more time. I do know that the children's vaccinations took a lot longer than a regular adult vaccination, because, you know, you have kids that are not really questioning what's in the vaccine. They're just more scared of like needles. So really taking time to making sure that everyone is comfortable with the process and understand the importance.
Yeah, that's great, Matt. I think two things stand out from our experience with children. One is moving away from the classic picture of a child getting receiving a vaccination and having a shocking look on their face. So, you know, imagery is in so many ways everything, and moving to pictures of children receiving vaccines that, you know, are not, in shock. So we've seen a lot of that. It's also equitable representation and imagery, you know, Black and brown populations, you know, across the board. And the other phenomenon we saw was children actually influencing and encouraging their parents to get vaccinated, or the adults to get vaccinated. So it's sort of the inverse, as you're talking about, Matt, is, you know, the power of youth and engaged youth and knowledgeable youth, especially teenagers, encouraging their parents to get vaccinated. So that's also another resource to reduce vaccine hesitancy, which we've seen some success with. Karen asked, how do you decide which local partners to hook up with? I think we touched on this, but maybe you can add a little more commentary on that.
Usually when it comes to vaccines, the health department always has to be involved. In the case of, you know, Brazil, because of the universal healthcare system, we could only procure our vaccines through that system. So we had to work with the health department. You know, so health department always has to be involved. And then in terms of local partner, you know, if you need an implementing partner and such, it's really, I think in my experience, a game of networking who we know. I know in Brazil, we worked with a local partner called Viva Rio, which is a partner from Haiti that CORE has worked with in Haiti, and they're based in Rio. So that's how we just naturally came together as partners from Haiti to Brazil.
Great. Jean-Pierre asked, do you have any experience to share regarding the vaccination of healthcare personnel?
Yes. So long ago. I remember I was in Los Angeles at this time, working at the Dodger Stadium mass vac site, and it was a high volume. There was a ton of healthcare professionals wanting to get vaccinated. I think the most challenging aspect of it was making sure that these people were calm and trying to build patience within the patients, because I think a lot of these people had thought that they could, you know, skip the line, they can do whatever they want, they can get in, get out type of thing. But it was right in the beginning of operations all across the US, not just with CORE. So there was a big learning curve in this first couple weeks of vaccinating. So this was a time when we were still figuring out how to make the flow of the operations of the site, figuring out how drive-through works, how walk-up works. So with the healthcare professionals, it was really important to try to ask for their patience and allow for them to just write out the process of you know, mass vax, which was so new to everyone in the United States.
Yeah, that's great, Matt. One of our observations from healthcare personnel was not so much individuals, healthcare personnel receiving vaccinations, but just thinking through who's going to staff what positions at these sites. And, you know, we had a lot of, you know, volunteers, which was amazing and awesome. But there was an assumption by many they could just show up and start putting needles in arms. And, you know, we really had to, you know, develop and build on prior experience, but develop, you know, sort of just-in-time training tools for people that had never administered vaccines before. So, you know, doctors, for example, at least in the United States, for many specialties, it's not routine for them to administer vaccines individually. Usually it's a nurse or technician that does that. So, you know, we had a lot of volunteers, and we had to sort of re-triage and educate and provide training tools for those individuals. We credential them and they could do it safely.
We had that too with EMTs when they, in California, they allowed EMTs to learn how to vaccinate. So we had to work with our local fire department and our medical oversight to bring in, you know, EMT firefighters, regular EMTs to teach them and go through the process of, you know, providing the medical oversight for the people that were newer to vaccinating.
Awesome. I don't see any other questions in the chat. Are there other questions? raise your hand or put in the chat. Any experiences people would like to share, or questions in general related to mass vaccination sites? And Steph asks, what is the next challenge for vaccinators globally? What do you think, Matt?
It's a good question. I think it's a matter of access. I think we got as much as we could from urban populations and populations that could get vaccinated. Anyone who has access to a vaccine has either gotten it or they won't. And I don't think there's going to be much movement in numbers in the areas that already have access. I think the next challenge is getting the vaccines to more remote communities, to places that don't have access.
Yeah,
I think
great.
that also echoes Carla's comment in the chat about their experiences in the DRC with similar challenges with access and the need to combine with kind of outreach vaccination activities, which I think we're hearing from a lot of different locations on contexts about the need to solve some of these access challenges.
That's great. Thanks, Jenna. And thanks for calling out. Carla, thanks for your comments. Okay. Well, today has been really informative. Insightful. Yep, go ahead.
Apologies, I don't mean to interrupt, but we just had one more question pop up since we have a few more minutes.
Oh, great. Thank you. Is vaccination site the best strategy for all countries within lower income? So maybe for lower middle income countries, is vaccination site, maybe mass vaccination site. Matt, do you want to take a stab at that?
Yeah, it really just depends on local context, because you can have mobile teams, which could be considered a vaccine site, a small group of people, a vaccinator and administrative support, logistics, et cetera. And you can also have smaller vaccine sites, that maybe have a capacity to do a couple hundred per day. And then you can have the massive vaccine sites, the drive-throughs, et cetera. So it really depends on local context, because, things to take into consideration is, do people have cars? Do people have time to go to a vaccine site? Do you have to adjust your hours, et cetera? I think no matter where CORE has gone, vaccine sites have been really important and integral for the local health systems and relieving pressure off of local health systems, especially in times of high demand. So I do believe if you're in a country with high demand and lower income communities, then vaccine sites are a good way to go. And then it's just a matter of figuring out which type of vaccine site to implement.
Great. And Karen made a comment, and feel free to expound on it. My experience as a workforce lead in a large vaccination center was that it was really difficult to maintain quality of vaccinations with a large number of difficult health professionals who had never vaccinated before. Yeah, difficult maybe, and different types of health. We mentioned paramedics, emergency medical services, laypersons, doctors, nurses,
MAs, everything.
Yeah. Students. So there's a variety. There's certainly an important element of quality control, both from a personal standpoint and an equipment standpoint.
Yeah, I remember at Dodger Stadium, we had broken up our site into 3 different zones: a zone A, zone B, and zone C. And if we had a day where we had a nursing class come in, that we would concentrate everyone to one area. We'd put all the nursing students in zone A and the specific section of zone A where their professor could give medical oversight. We had our team to provide medical oversight, and you're really making sure you're being as organized as possible when it comes to where you're putting your vaccinators in the larger operation. It really helped to do that.
Yeah, those are great points. And Carol, you said, good point, Karen, maybe supervision can be addressed here. I think you answered that a little bit, Matt. We had 4 mass vaccination sites running volumes from 1,200 a day up to one that was 6,000 a day. And clearly there's an association with quality assurance and ratio of supervisor to vaccinator. We had a really robust effort at the 1,200 site with an improved ratio, 1 supervisor versus 20 to 30 vaccinators, versus we had increased ratio, meaning 1 supervisor to 50 vaccinators at the larger scale sites. And you could see that there's certainly more QA issues. We did empower and train each of our, as part of their orientation, each of the vaccinators with a tool. We had a reporting tool that was that people could log in from their phones and do a quick report, like a 1-line report, list the patient and list their concern. And that immediately would go to supervisors both on and off site. So we could troubleshoot that and commit to an improvement strategy within 24 hours. So we crowdsource safety. So if a person saw a safety issue, they were empowered to identify it, report it, share it, and then we would capture it to troubleshoot it within a 24-hour period. Let's see here. Karen also says, often old nurses and doctors who think they know better. I'll let that sit. But it is true, training individuals on a new skill set is important, and maintaining that level of quality. Jean-Pierre asks, is there any experience to share on gender-related barriers to immunization and how to reduce them? Matt?
I would have to sit on that one. I'm not too sure on any experiences that I've personally had working with gender-related barriers, but I'm sure someone within CORE has experienced this, especially on our community mobilization teams that exist in Los Angeles or Georgia, New Orleans, anywhere in there. I'm sure there's some experience from there.
Yeah, thanks. Anyone have any comments on this question? There's been a fair amount of research on racial and ethnic barriers or associations with vaccine hesitancy, which we've seen across the board. I'd have to look. My guess is there's probably some gender-related issues identified, to Matt's point. So we could take this as a follow-up and see if there's something we could post on our website for the community. So thanks for that great question, Jean-Pierre. Karen also says, as even the clinical supervisors were not experienced vaccinators prior to COVID, so we're always recognizing poor practice and rectifying it. I think that goes back to the, identifying the vaccinators, supervisors, et cetera. Steph says in other meetings that there's hesitancy among women fearing issues with fertility. Certainly, there's qualitative data on males and females and males around fertility issues, and again, sort of combating the challenges of misinformation within the media and social media that we've all been navigating.
And regarding those gender-related barriers, we also just recently ran a Boost survey looking at kind of demographic differences in COVID-19 vaccine demand. And we definitely see some really significant differences related to gender, and some experiences not only with hesitancy for gender-related issues, but also access, women not having access to or transportation to the sites. So I think there's still a lot of work to be done to explore those issues. But it's definitely a common challenge that we've seen.
Great. Thank you, Jenna. So I'm going to read this last comment and then we're going to wrap it up. This has been a really, really wonderful conversation. So Carol, you get the last point. Important to include women in promotional materials. Also ensure outreach workers and health staff can answer questions about COVID-19 vaccines and pregnancy. Yeah, that's incredibly important and salient salient point to lower some of these hesitancy issues that we've all identified. So it's been a great hour together. Thank you, number one, for Matt for presenting and answering all of these questions. Thank you to the team in our community for asking the questions, showing up, asking the questions, and building and learning from each other. And thanks to our team that supported all the logistics behind this effort, Rebecca, Judy, Jenna, Liz, Steph, and others, and Natalie as our French interpreter. Hope everyone has a wonderful day. Please go to our Global Mass Vaccination Site website, which is at the top here and it's in your chat. Take our survey so we can learn more about your experience and how we can help. This is your community and it's here to help you in any way we can. And join the Boost community, as Jenna spoke about. It's an awesome resource with many, many different tools, colleagues, peers, teammates to work through it together. I think our next event is coming up 2 weeks from now, I believe. And so we'll share those invites out with the community. Look forward to seeing you in a couple weeks, and have a great Friday. Thanks so much, team.
Thank you, everyone.